Hello there. Today I'll be concluding on the series I started last week talking about erectile dysfunction. Today we'll be talking about the treatment of erectile dysfunction. Welcome to Health Today with Dr. Ide, where I talk about your health and wellness. I am Dr. Olaide Shinodu. If you're not yet subscribed to this channel, I think you're missing out. Why don't you subscribe right now, then hit that notification bell so you get notifications every time I post new videos. Now straight to the chase. We spoke extensively about erectile dysfunction last week. Now we'll be talking about how to make a diagnosis and how to treat. For us to confirm a diagnosis of erectile function, some laboratory investigations are very necessary. One of them is hormone profile, the male hormone profile, particularly the luteinizing hormone, that's the LH, prolactin, I guess you're surprised, prolactin, and the thyroid function test as well. Other blood investigations are HbA1c, that's glycosylated hemoglobin. This is one of the most fantastic tests to determine if a patient is diabetic. Remember we mentioned last week that diabetes could be a cause of erectile dysfunction. So confirming the disease is not out of place. Lipid profile, that's to check your cholesterol, your body cholesterol. A PSA, prostate specific antigen. Remember we mentioned prostatic cancer and prostate enlargement as one of the probable causes of erectile dysfunction. Then urinalysis, analysis of your urine sample. Yes, because there's some key elements you want to take into consideration, like finding of glucose, protein, red blood cells, white blood cells in the urine might be a pointer to a urinogenital disorder. The next one I'm going to mention can either be an investigation or a treatment, and that's the direct injection of prostaglandin E1 into any of the corpus cavernosa. Remember we mentioned that last week. Another investigation is a biodexiometry, where the sensitivity of the skin of the penis is tested to vibrational stimuli. You could also get an ultrasound scan of the penis done. This will let you know the blood flow. We spoke about blood flow as one very important factor essential for the erection of the penis. So a Doppler ultrasound will show us if the blood flow to the penis is adequate or not. We also have an angiography of the penis. All these tests are just to detect the probable cause of the erectile dysfunction. The kind of erectile dysfunction discovered will lead us to the kind of treatment. Now there are 4 major treatment modalities. Treatment modality number 1, sexual counseling is necessary if no organic cause can be found as a direct cause of this erectile dysfunction. Treatment modality number 2, oral medication. Some oral medications have been found to be very, very effective against erectile dysfunction. I would advise you see your urologist and at times your cardiologist. That's if you have an underlying cardiac condition. Treatment modality number 3, the use of external vacuum devices to ensure or to improve erectile function. Then treatment number 4, the surgical intervention. Now there are many types depending on the cause. Now your urologist would determine which is best for you. Few examples are revascularization of the penis, penile implants, and balloon angioplasty. I know all this might sound like a mouthful, but I can assure you erectile dysfunction is very treatable. You have to get to the root cause. After finding what the root cause is, believe me, you can get treated. Another treatment modality is if it can be established that the erectile dysfunction in question is caused by some certain drugs, you would have to stop those drugs. I'd like to talk a little about the sexual counseling. I've seen a lot of young men who come to see us for erectile dysfunction, and I can tell you that most of them have erectile dysfunction as a result of anxiety, especially what one friend has told them or the other, that no, I last 2 hours in bed, I last 12 hours in bed. You need to seek expert advice to be very sure that what you're dealing with is erectile dysfunction with an organic cause. Most people are just anxious. If you just love this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.